So I'm pleased to present my report as Chief of Staff. This past year was a difficult one for Health Sciences North's team of frontline caregivers, but it was also very rewarding. As an emergency department physician, I can tell you firsthand that our physicians and frontline staff often bear the brunt of people's frustration with the healthcare system. Most times, our staff share those frustrations. Nous sommes également découragés à la vue des patients dans les corridors ou sur les civières au service des urgences en attente d'un lit d'hospitalisation. In the midst of high-pressure environment, our people demonstrate remarkable poise and dedication in dealing with these challenges. It was one of the busiest years on record in the emergency department here. There were 73,000 patient visits in a department that was designed to treat no more than 66,000. Patient days in the ED also increased by almost 1,000 over the previous year. That seriously impacts the ability to flow patients through the emergency department. Pourtant, les temps d'attente des patients qu'il n'était pas nécessaire d'admettre à l'hôpital étaient dans les moyennes provinciales où ils étaient supérieurs. That's an incredible tribute to the ED team. The frontline staff and physicians in our inpatient and outpatient units are no less worthy of praise. We dealt with approximately 24,000 admissions and 352,000 outpatient visits, many involving lab and diagnostic tests. There were many achievements to be proud of. Nous effectuons de nouvelles interventions chirurgicales avancées. De nouveaux programmes ont été mis en œuvre à l'hôpital afin d'aider les personnes âgées fragiles. In partnership with the City of Greater Sudbury and the Greater Sudbury Chamber of Commerce, I like Converse though, we were able to attract 17 new physicians to Sudbury in 2015. So far in 2016, an additional 14 physicians have been recruited. We continue to draw large numbers of medical students and other learners to HSN. This past year, over 2,100 medical learners of all disciplines had placements at HSN. Les apprenants donnent des soins pendant leur apprentissage. Et ainsi, durant leur formation, nous augmentons les chances qu'ils demeurent avec nous. Our physicians continue to take leadership roles in mentoring medical learners and working with hospital staff to develop and launch improvement plans for patient care. We enjoyed another incredibly strong year of specialized training in our simulation lab. Approximately 1,800 learners logged 13,000 hours of training time in the lab this past year. A rare opportunity presented itself when our sim lab was featured on CTV's top-rated show, The Amazing Race. Our sim lab crew took full advantage of the high ratings this show generates to do some important public education around CPR and the dangers of driving and texting. Cette année, le directeur médical du laboratoire de simulation, le Dr. Rob Anderson, a reçu un prix d'excellence en enseignement afin de souligner son rôle à l'École de médecine du Nord de l'Ontario. Our virtual critical care unit also garnered some attention this year when it expanded to encompass 27 hospitals in northeastern Ontario. By working in partnership with the Northeast LHIN and other hospitals, we're able to keep at least 80 patients and their families in their home communities instead of transferring them by costly air ambulance. It's better for patients and their families, and it saves the healthcare system over $1 million. The virtual critical care unit team won the Ontario Health Minister's Award for Patient Safety and Quality. Nous avons présenté à des congrès professionnels afin d'échanger sur des pratiques exemplaires, par exemple dans les domaines de soins cardiaques et de la médecine d'urgence et de la santé mentale. Looking to the future, we know we will continue to be challenged by providing timely access to care for patients. We are committed to working with our healthcare system partners to make improvements in that front line. Despite these challenges, our physicians and staff remain steadfast in their commitment to our patients. I'm extremely confident that the next year will see us continue to be leaders in patient care, research, and teaching. As the largest healthcare facility in Northern Ontario, we will steer the course towards innovative best practice care for the communities we serve.